my passion for helping people through mental health issues and what fuels that is just that it's so rewarding when we do help them progress through their problems. There's always work to be done, and it's not about perfection. It's about progress and just baby steps. It's a trajectory, sometimes one step forward, one step back, two steps forward, one step back. We just, want to make sure that we're there for them and help them in any way that we can. And I just love to be a part of that journey for them to wellness and to feeling better.
That's so good.
Well, I have a ton of experience in various fields of nursing. So I started out as a nurse in like medical surgical, taking care of all kinds of surgical patients, all kinds of medical patients, intermediate care, even sometimes ICU. I've worked in dialysis, mother baby, and also I've worked in a jail as a nurse practitioner. I've worked inpatient psychiatric with adults and adolescents. So I just think I want to work with anyone who wants to work with me, who feels that they need help and is not afraid to speak up and ask. The medication evaluation is so important because medication may not always be an option, but it's so good to meet with a provider so you can review what you've tried in the past. Did it work? What side effects did you have? What are your thoughts about taking medication? What other approaches would you like to take? And then also considering like what kinds of barriers there might be, such as how much does the medication cost? Because that can, be a huge roadblock for some people. Discussing side effects and, how are they able to be compliant with it, to remember to take it, and things like that. So it's not always an option for everybody, but it's so good to, at least consider as part of their treatment plan. Because sometimes life throws you curveballs and you could be managing on your own just fine for years and years or all your life and kind of think that you're against medications as treatment options. But there are oftentimes, periods of your life when you struggle harder or there's, more outside influences or stressors going on that really you just might need a little extra help to get you through. Taking medication doesn't mean you're going to be on it forever. And if anybody decides that they're doing better at a certain point and their, stresses in their life are down and they want to wean off of it, that's always an option as well. Other benefits are that you have monitored treatment with a medical professional rather than seeking outside, kind of self-medicating with, drugs or alcohol or other unhealthy habits. So kind of having somebody on board with you to encourage you, support you, educate you, and keep you on track is definitely paramount. There's so many myths about taking medications, especially mental health medications. We need to lift the stigma. It's not a weakness, okay? Everybody goes through stuff and anybody can lose their crap. Stuff happens and life can come at you fast. And sometimes you just need some help and support to get through it. And medication can often be part of that. So the first one I want to say is that taking medication does not mean you're weak. It does not mean you're vulnerable or, less than anyone else. You don't have to always toughen up and just put up sticky notes with good vibes only and just push through it. Other tools I like to use are, teaching or reinforcing coping skills, recommending that patients try meditation, mindfulness, journaling, even like keeping a gratitude journal. That always helps to remind you of all the good things that you do have. It's easy to focus on the negative sometimes when you really are feeling down. Getting regular exercise, trying to eat a healthier diet, and setting small goals that are reachable, measurable. Yeah, because it's super rewarding to set a small reachable goal and then to reach it. It really feels good, And so sometimes you do have to kind of hustle a little bit, but cut time out for yourself and make a plan to do that. So whether you're a person that likes to make a to-do list and it feels really good to cross off those things as you do it, I encourage you to do that. And, meditation might not be easy for everybody, but the more that you practice it, the easier it gets and the more that you'll want to do it and, really get rewarded internally and makes you feel a lot better. So to maintain my own mental health, I love that question. I grew up as a dancer and I just kind of love like goofing off, dancing, being silly. But sometimes, if you're in a mood, music is a huge tool. It can be helpful to listen to music for the mood that you want to be in. But sometimes if you're just feeling bad, you need to just feel it and get it out. It's like, I don't know, being hungry. You're not gonna not be hungry until you eat something or having to go to the bathroom. Sometimes you just got to get it out, And so that music is a huge, like, totally beneficial tool that you can use to just get things out and feel what you're feeling and go through it. And then when you're done, you can be done with it and move on and start to feel better, focus on something else. Maybe that's the time when you switch it to more upbeat music once you felt that emo, whatever, or just rage, rock it out and scream your butt off. Go pound on your bed sometimes and just scream into a pillow if you need to. Taking it kind of far. But everybody needs to sometimes just, do that so that they don't punch a hole in the wall or whatever. But other things is just, doing your hobbies. Like I love to craft with my kids. And so cutting out time for that is super important. And being able to spend time with my family and watch them like react to the attention that I'm giving them, that makes me feel better. Other times it's just saying, hey, we're not going to do anything today. Lower your expectations. Let those dishes go. Let the floor be dirty. Let the laundry pile up. That will be there tomorrow. But if you could kind of turn a blind eye to it and maybe just watch shows all day, order some takeout, have it delivered to your house if you even need, those things at times can really like let you rest and recharge and refuel. Other things too are reaching out to a like trusted friend or, a family member, and sometimes just being able to blow off steam and just totally dump truck on them, knowing that they're not going to hold it against you. You might want to preface it with, I just got a vent, and get it out and you'll feel a lot better. Or go for a walk, go for a hike, pet your dog, or do something nice for someone else. Just to see their appreciation is oftentimes like super rewarding and recharging. So my role in a patient's care team is different than a therapist or a primary care provider because the therapist really focuses on the counseling piece, a lot of teaching coping skills, offering support, giving them some homework assignments. And while we, as the providers, do some of those things, it's really good for people to go practice that, and it just offers more support, and they're kind of held more accountable when they're in therapy. And it's just a reinforcement that, is just good to have. It's like some people, go to church every Sunday because they need to renew that, commitment that they made the week prior. So it really just helps you stay focused and committed while we're here to really get to know you and focus on like the issues that we're treating. And medically, especially when it involves medication, then we need to talk more about the side effects, how you're doing on that. Is it keeping you up at night? Are you eating okay? So it's a little more medically focused on the physical, but still mentally. Primary care providers are absolutely wonderful, and you still need to see them from time to time, but we work, in conjunction with them, can collaborate on certain things. And, like if you have labs drawn there, I would love to see a copy of that, vice versa. If we draw them, we would love to send them a copy. But they just typically have a lot more going on throughout the day, and so they aren't able to spend as much time as we are.